Good afternoon, everyone. Oh gosh, it's good to see all of you out here. I'm Karen Jackson. I'm the Acting Deputy Chief Operating Officer, and I want to thank you all for coming to today's all-staff meeting. It's been a while since we've had an opportunity to get together. The last time we were in this room was back in February, and you saw lots and lots of accomplishments over the last few months. Well, they're gone now, but they were there before, and we asked you to just give us a very, very quick overview of what you've accomplished since February. We ran out of time. There was so much, so we had to do the reeling through as you came in. So thank you to all of you for your hard work and continuing to carry forward the agency's mission. We have a lot to cover in the next hour. I promise it's going to be really, really interesting, and I suspect you'll learn a little bit and might have some fun along the way. We're going to start today with Andy and Mandy together, reflecting a little bit over the last few months and what's coming up over the next few months. We're also going to spend a little bit of time later on. Patrick Conway is going to be leading a discussion about implementation of one aspect of the Medicare Access and CHIP Reauthorization Act. This would be the Quality Payment Program, which we are, many of us, very heavily engaged and involved in implementation. And I want to just say welcome to Dr. Natasha Washington. She is Executive Director of the Consumers Advancing Patient Safety Organization in Chicago, Illinois, and she is a patient advocate and will be joining us on the stage to talk about MACRA implementation and the Quality Payment Program from an advocacy perspective. Later on, we will hear from Cara James and our man in the field, John Hammerland, talking about some activities around rural health. And then if we have time, and we're a little bit pressed already, but we'll save some time for some Q's and A's along the way. I'll give you a little warning. Both Patrick and Andy and Mandy need to leave right at 2 o'clock for a meeting with Secretary Burwell. So we'll try and close things out by around 2 and get you all back to your offices. So without further ado and delay, I will turn this over to Mandy and Andy. Before I say this, though, the last time we saw you here, I think both of you were slinging food in the cafeteria, brownies and pizza and cake. We'll work on the food for the next time. So it's nice to have you back.
Great. Hi, everyone. Good afternoon. So I'm going to do my best Barbara Walters impersonation here. As per usual, you know, Andy likes to chat, and so I thought I would help kick it off with a few questions, and then he can share some of his thoughts. So, putting on my Barbara Walters hat. So thinking back, it's been a great year, couple months. What are you most proud of?
Well, thanks, Mandy and Karen, and hey, everybody. Apologize for the heat. Hopefully it'll cool down a bit. You know, I'd say that if you sit back and take a little bit of perspective over the last few months, you can't help but to have two conclusions. One is to be incredibly impressed with the work that we've done. And I look, that's across the Medicare program, it's across the Medicaid program, it's across quality, it's across program integrity, it's across the marketplace, duals. There's been a real, I think, focus to delivering high quality work that matters to patients, consumers, beneficiaries, and in each of those areas. And I think the same is true for our offices. Our offices are really in gear in supporting the work that's going on at the centers. I think the second thing I'm probably excited about is just actually the way we're doing our work. Not just the work itself, but the approach. I see a lot of focus on working together, a lot of focus on collaboration, a lot of focus on teamwork. I see a lot of focus on regions and the central office working together. And I see a lot of listening, a lot of feedback. You know, all those things are things that if we didn't do them, our work would probably still get done. it just wouldn't get done as well. And I don't think our impact would be nearly as great. So I'd say both of those things.
Terrific. And as you look forward to the work ahead, what are some of the opportunities ahead for the agency? What are you looking forward to in the next 6 months, year, 5 years for the agency?
So it's a great question, and I think it's something that we all ought to, every once in a while, stop and take a step back. And all you have to do is compare the work we're doing now to the work we did 2, 3, 4, 5 years ago to see that it's much more cross-cutting, much more complex, much more impactful, and I think that's going to continue. So I think my message would be people across the agency are doing a great job, number one. Number two, we're not going to skip a beat. We've got a transition coming up, but we're going to plan right through that transition and keep up the momentum. There's no reason not to. But also, I think to Mandy's question, there are a set of changes, and I think Patrick and others are going to talk about some of them shortly, that are going to have, I think, far-reaching impact, first on the Medicare program and how we pay, but ultimately how physicians will interact with us, and more importantly with patients and the system. And we have a big opportunity to influence that. I think the thing I look forward to is, just like the last period of time, we have a couple paths we can choose. We can choose a path where we are doing a lot of outside-in work and getting in touch with how the work we do impacts physicians and patients. And you're going to hear a lot about that today. Or we can not choose to do that, and I think the implications of that, I think, will go really to the shape of where healthcare will look like in 10 or 15 years. Because I do believe, as we've all said before, this is the most impactful organization in the healthcare system in the U.S. by far. You are the most impactful people. And then the second is just this willingness to bust our own silos, because we're guilty of the same thing the rest of the healthcare industry is too, which is we work in our own units, and the problem is everything that happens in healthcare doesn't come to us neatly and discreetly in our units anymore. There are still Medicare challenges, there are still Medicaid challenges, there are still SIO challenges, but many of them are cross-cutting. And so I'd say 2 years, 3 years, 5 years from now, I see the habits of how we work together really being a significant input in our ability to succeed, and I think that also creates career leverage for everybody. I think that just gives everybody an opportunity to learn, which in my time here I think is something that people value.
Great. And we all know that you have laser focus on our consumers, beneficiaries, the providers who interact with us. How would you grade us? How are we doing as an agency, and where are we going?
So, we ought to be, I think, tough graders from the standpoint that we ought to be letting the people who live with our program really give us a scorecard. And if you look across our programs, I think there's no question that beneficiaries depend on and are happy with the benefits that are offered and that we deliver every day. And so from that standpoint, that's, I think, quite positive. I think where we would challenge ourselves is if you ask people, people might still say that we're still a little bit mysterious. We're still, because we have such power over their day-to-day lives, people strive for more visibility into what we do and what we're going to do and how we make decisions. They want to know how to interact with us and give us feedback. And I think that's probably always going to be the case to some extent no matter what we do. And we have to do very hard things and people aren't always happy with us. But I would say I'm starting to hear, and I think you may be starting to hear as well, that people feel like we're easier to connect with perhaps than we were before. That there's a human side to us that I think really means a lot to them when they go through what they're going through, that we're listening and that we're making an effort. I think that's a great first step, to our brand, to all of us, to the work we do every day. And I think so I've been very proud of some of the things that we've heard, but I think, realistically, it is the beginning of a different way of thinking and orienting ourselves.
And building on that, I know you've joined the Twitter universe, and that's not just to share messages outwardly about what we're doing, but I know that you very much look at the folks who tweet at you for feedback. How has that changed how you are thinking about how the external world views us, changed your thinking, or anything you want to share with the rest of the folks who may not follow your Twitter feed, but should?
It's a bit of a blessing and a curse. I mean, honestly, it's a bit of be careful what you wish for, because, I read my email box, all the beneficiary emails, all the physician emails. People aren't shy. You get a lot of the same things. I feel it's very important for me to be in touch with those issues. With Twitter, in part, I feel like I'm communicating with all of you, because I don't, whether you follow it or not, I feel like it's an easy way for me to just describe what's going on and what's important. So, today I tweeted about a lot of great work being done to serve young adults across and help them find coverage through the marketplace. We have several things a day that are really important and newsworthy, that really reflect on all the great work that you all have done. And part of building our brand, I think, is sharing with them and having them see all the immense amount of great work that you all do. So I get a kick out of showing that off and representing that. And I think others do as well on places like Twitter. But then you're exactly right. It's letting people know that we listen, that we're not above, that we don't have all the answers, and being in touch. And you tend to hear people with the strongest opinions. Sometimes that's the curse part, so you can't overread it. But when physicians talk about all of the paperwork that they feel like they have to do, and feel like we're to blame, it's an easy, natural reaction to get defensive and think of all the 10 reasons why not. But it's even more important to understand that reality and try to understand it even better. And then I think you'll hear from the team that we pick up on those clues, and the team does great work to, suss it out. So it's a great early warning system. And, if you're not on it, I'd encourage you, feel free to follow me, or, it's just this new modern age.
And not all bad. I've seen some really great actual feedback on Twitter to the testament of the team, particularly around how the agency has approached this new work that we're going to talk about, MACRA, and the listening that the organization has done systematically, and you're going to hear more about it. But Jean Moody Williams and others who have led that has been really tremendous. So let me transition for 1 second and truly be Barbara Walters here. You've had a personal milestone recently with your oldest son graduating high school, going on to college. That certainly brings, I'm sure, a moment of reflection for you personally. Anything from that time that you want to share with other than thinking about the college bill and all of that? Anything else you want to share? We see you've grown a beard. I don't know if that's part of anything that's going on that you want to talk about with us here.
This is like where Barbara Walters tries to get you to cry.
Exactly.
Right?
I'm working it.
Yeah. Well, I mean, look, just my own thing is just for all of you, what I wish is that you cherish all of your personal milestones, because we all have so many, and we also obviously have very sad ones in our lives. That when you get the happy ones, you just find excuses to celebrate and make sure you take the time, and that's certainly. I mean, I'll have my 20th wedding anniversary this year. I have a big birthday this year. Maybe that has something to do with the beard and the socks. I don't know, but like you know, this is a place where, in some ways, you get to not only focus on your own milestones, but you get to get people to celebrate, help people celebrate more milestones when they come home, when they get out of the hospital, when they get sick, when they go through something scary, because this is all so personal. So, I think that's all good reflection for us. But it's certainly my hope that for how hard everybody here works and for all you put in and all you contribute, that you don't forget those moments. And I get the same.
Terrific. And speaking of family, we certainly are one here at CMS, and we welcomed 2 new folks to the family in leadership roles. One of them is new to CMS, but not new to government, Juliet Johnson, who's our new director of the Office of Communication. And second is welcoming someone back to the family who was here before, Melissa Sterinsky, who is going to join us to lead our contracting and grants management work. So excited to expand our family, welcome others back. And then I know we also wanted to make sure, sadly, we also know family members move on to bigger and better things. And so one of those who we've been able to say goodbye to last week, and I think his last day is coming up, is Mark Hartstein, who's just been such a rock for the agency. I know you wanted to mention a word.
Yeah, is Mark here? Where's Mark?
Hi, Mark.
I'm sure many of you had a chance to work with Mark, but Mark, you're one of those people that universally around the healthcare system, you represent a certain level of excellence and quality and listening and commitment, and such a critical part of what we do that you've made us all so extremely proud over the years. And on behalf of everybody that's been here before me and us, I want to thank you for that. And I'm also assuming and hoping that all the people you've trained up behind you, I know they're raring to go. I mean, this is in part what milestones are for. So I'll just ask, after you're done, I'll ask you a question, Barbara.
Really? Is that how that works here?
Well, I guess the question I would ask you in the kind of context of your chief operating officer role is, you've been through the evolution of the implementation of the ACA. You've been through the implementation of ICD-10, and now we're just sort of beginning, but moving very rapidly through this implementation of MACRA, which we're going to hear about today. And I guess the questions for you are the operational organizational maturity that we clearly didn't probably have 5 years ago or 6 years ago, whenever that was. And as you watch us evolve, what lessons do you see for the agency operationally? How well are we, doing along that path? And where do you see the places we need to focus?
Great question. So I think you hit on one of the key themes, which is the work doesn't come to us in discrete packages anymore. Maybe it never did, but it has given us the opportunity to create some new muscles across the agency to create these integrated teams and think differently about the work and who you're interacting with every day, and the collaboration that is needed. And the need for communication amongst those teams has just been increasing and more important every day. And I see us improve upon them each time. As you're going to hear more from Karen Jackson about this in the next panel, but what MACRA allows us to do is take all of those lessons learned that sometimes we learn by doing it the wrong way first and needing to course correct, but being able to set out on a course with all those lessons and chart a course for MACRA to not just think about our own internal operations, but how we interact with the our external stakeholders in the external world differently. It's really exciting that we're able to plant some of those seeds. again, kudos to the ICD-10 team, the biggest transition, technology transition we happened that no one heard about, right? Because it went so smoothly, really tribute to that team. And so thinking about that vigilance and that type of discipline to work collaboratively, work with external stakeholders, we're getting so much better at the agency, obviously always room for improvement, and we'll continue to do that improvement. And I'm sure Karen and the rest of the folks will touch on more of that as we come up. So last question, and then we'll move on. So with I think the president counted for us, it's 220 days till transition time. What are you focused on in these next 220 days? What should folks who are listening be focused on? And talk to us about the transition. Clearly that creates some amount of anxiety, and how should folks be thinking about it?
Well, I think the great news for this agency, it's true more so than ever before, is the agency doesn't depend on any one individual. And if it did, it certainly wouldn't be the administrator. It would be Mark, probably.
True. Don't go, Mark.
But while everybody's valuable, the reason we structure the work the way we do, and the reason we're building the teams and interdependent focus and so forth, is because it's not dependent on any one individual. So I think we have a responsibility, I have a responsibility to spend the next 6 to 7 to 8 months really focused explicitly on the nitty-gritty details and concerns of transition, so that we don't skip a beat, because our work is too important. I think far more will stay the same than will change. I'd say something's going to change all the time anyway, so I think you might just bucket this into a category of the kinds of changes that you're all very used to and that happen all the time. I would say that I'm very, very confident in the career leadership and all the key parts of the agency. There is nothing that we do from a decision-making standpoint that doesn't involve that leadership, and I think that'll be even more so the case going forward. So I want you to know that we'll have my personal attention as a high priority. I know it will have the rest of the teams, but I think we'll come through this flying colors. And the reality is, this is an organization that we'll just continue to get better and better and better all the time. So I think we'll have a chance to talk more before the transition happens, but I fully expect this place will be far better after I'm gone, even than it is today. And I think it's a pretty great place today. But I'm confident because that's the ethic that's here among the team.
Okay, great. Well, with that, I'm going to turn it over to our other leadership and a great panel discussion.
Great.
So I'll call up the panelists here in just a second. Two quick things before we jump in. One, had the opportunity to speak to a bunch of healthcare CEOs last week at a conference, and then was speaking that evening, so got to hear a lot of them speak afterwards. Across payers, providers, medical device, other companies, they talked about how CMS is shaping the market, is improving care for millions of people, and really a huge positive impact on our health system. And I think that'll relate to MACRA across the board. Two, they really talked about that collaboration and partnership, and that CMS is seen as a strong, good partner, whether it was a payer, a provider, or other CEO, which I think critically important, and really speaks to your public service. Melissa, I want to welcome you back. Mark, I want to add my congratulations for your many years of service and impact on millions of people. We'll welcome you back in 5 years. And in all seriousness, now we'll move to the panel. I will call out a couple things about the Medicare Access and CHIP Reauthorization Act of 2015 before we sort of dive in. Number one, it's truly the biggest change in physician-clinician payment and linking that to quality and value in Medicare history. So it's the biggest change in U.S. history in physician quality payments, so a big deal. Two, it's a huge opportunity, I think, for the program to be truly clinician-driven and patient-centered and drive those better health outcomes for patients that we all want. And you're going to hear a little bit more about this today. And 3, and I think you'll hear this from Karen and you heard it from Mandy and Andy, I think a huge opportunity for even more enhanced collaboration across the agency where we're executing across multiple policy centers, operations, all the support functions that lead into that, our thousands of contractors that we know that execute these programs. So I think this agency has a history of being mission-driven and delivering on huge challenges. I think this is one of those really huge challenges, and I saw even yesterday, teams diving in to solve the challenges together. So I think an incredibly exciting time. So with that, I will call up the panelists. We have Karen, and you can choose a seat with a microphone. We have Karen Jackson, Deputy Chief Operating Officer. We got Dr. Kate Goodrich, who's the Director of the Center for Clinical Standards and Quality. On VTC, and hopefully this will work, we have Ashby Wolf, who's Chief Medical Officer in the San Francisco Regional Office, via teleconference, and a special guest, most importantly, Dr. Natasha Washington, who is Executive Director for Consumers Advancing Patient Safety, or CAPS. She's a master change agent, professionally changed in healthcare and business process redesigns and administration. Shaped by her passion and belief in social justice, Dr. Washington has earned recognition nationally as a policy contributor, healthcare leader, and patient activist. And after many years of commitment to advocating for elimination of health disparities, her perspective on the U.S. health system changed dramatically after losing her father to a medical error. So we thought it was critically important today to have a representative directly of patients to talk about these programs. So with that, I will sit down. I am not Barbara Walters. I don't know what the male corollary is to Barbara Walters. Somebody will have to educate me on that. Morally safer, although, right? Charlie Rose, yeah, I don't know. That's, yeah, oh, geez, Charlie Rose. And I will say on the milestones, my kids graduated 2nd grade in kindergarten, so we're a little different phase. But, in classic fashion, we celebrated none the same. Actually, Kate, I'll start with you, just with a basic question of what is MACRA?
So MACRA, or is this on? Can you hear me? No.
Oh, you may. Sorry.
Now can you hear me?
Flip it on.
There we are, yes. So MACRA, or the Medicare Access and CHIP Reauthorization Act, was bipartisan legislation that was passed in April of last year, and what it did was it very famously, removed the sustainable growth rate, which was a very unpredictable method for which clinicians got paid through the Medicare program, and replaced it with something that we are calling the Quality Payment Program. And we released our first proposed rule on April 27th of this year. The comment period ends next Monday, so we're excited about that. And through this program, clinicians will have the flexibility to choose whether they participate in a program called the Merit-Based Incentive Payment System, which essentially combines features of the existing 3 quality programs that we have in place now, or they may participate in what are called advanced alternative payment models. And basically, the legislation really attempted to streamline quality reporting programs for clinicians while also incentivizing participation in alternative payment models. And I think the way we've really tried to approach it is with a few really important principles, one of which is to approach it in a manner that really drives improved outcomes for patients. I think that's one of our most core principles. That we reduce burden for the clinician community. We've heard loud and clear through all of our listening that our current programs are very burdensome, and that we actually provide flexibility for clinicians to be able to report to us and ultimately to other payers on measures that actually matter to them.
Terrific. Karen, what does this mean for employees, and how will MACRA change their work?
Well, in addition to all of the discussion about the policy implementations, I would just add operationally, it's really hard. But that makes it a lot of fun for all of us, I think. This really brings together the work that has historically been performed in the major centers across the agency, the Center for Medicare, the Center for Clinical Standards and Quality, bringing together the payment and quality management systems, as well as the work that the CMS Innovation Center has been doing for the past 5 years. And making that all work together seamlessly in a way that puts clinicians at the very center, understanding what it takes to be in MIPS or in an advanced APM, is something that we're very focused on. In terms of the implementation, it's been a lot of fun to watch some of the development work that is being done. We're using agile contracting methodologies. We're using agile system development in a way that we haven't had exposure to historically. So that makes it just really, really hard, but a lot of fun. And we're having an opportunity to work across and sort of tease information from each other in a way that I think we haven't been able to in the past. It's very energizing.
So Natasha, Dr. Washington, probably most important question, how can MACRA affect beneficiaries, patients, and consumers?
Yeah, thank you so much, Dr. Conway. I think a couple things I heard Andy mention earlier, patient-centeredness, and really moving in this way.
Sorry, there's a tornado warning.
Okay, all right, okay.
Don't let that stop
Should we
you.
evacuate the room? Yeah, okay, all right. So moving in this way really pushes us towards this patient-centeredness piece, meaning that there'll be more accountability for quality and more accountability for cost, and so those are the two most important aspects. I think also in terms of what patients and just general consumers, because at the end of the day we all work for real people, we work for the people. What we'll see is a few things. We'll see improvement in access. So in terms of our medical homes and in terms of our accountable care organizations, we'll begin to see what patients really need in terms of that flexibility in hours, things of that nature. So right patient, right resource at the right time. We'll also, I think, improve coordination is another thing we'll begin to see. And I can probably tell this better by example than anything else. So we have, as a part of my team, we also have a clinical lead who is a community health nurse. And just a few days ago, we were doing a debrief, and she was telling me about a patient that she was not able to get therapeutic. Basically, she had a patient that was being managed with anticoagulation therapy, both by the cardiologist and by skilled nursing that was coming in the home. And both of them were given two different directions to the patient. And so not only could this have turned out to be a tremendous patient safety from a medication error perspective, but just think about, the fact that you have a primary care physician who wasn't coordinating with the cardiologist, and the patient is caught in between. And so while the patient just wants to get better, and doing, what the patient has been told, the patient is getting messaging, and no one's collaborating. And so through MACRA, we're going to get away from this check the box, healthcare that we've basically been enduring, and move towards an opportunity to see that better coordination. And then that coordination, in theory, results in improved outcomes. Right? And so using that patient as an example, what you'll begin to see is, the better health outcomes for patients in general. So those are the three things that I believe that we'll begin to see as a result of MACRA.
That's great. Yeah. Thank you. Ashby, I think I see you on the VTC now as a practicing physician like myself, and I will say I've noticed now as I get older, when I worked this past weekend, I'm seriously tired the next week. How is MACRA resonating with the provider community?
Hi, good morning, everyone, or good afternoon, rather. So yes, with respect to the clinician community, there's a lot of enthusiasm and excitement. I think people are cautiously optimistic about some of the changes that we have proposed in our proposed rule that Kate mentioned earlier, we released in April, specifically related to the idea of decreasing administrative burden for the clinicians who are doing work of coordinating and caring for our beneficiaries. Specifically, also, I think clinicians are are interested in the way that CMS has approached this particular proposed rule process, which is significantly different from the way that we've done things in the past. I think we should call out the fact that there's been a tremendous amount of work done both in our central office as well as our regional offices to engage with the clinician community, to do focus groups, work groups, and feedback sessions as we've been developing the proposed rule. And then with the release of the proposed rule now, really working carefully to engage with probably our most vulnerable clinician groups, which are the solo and small practice clinicians, those who are in rural or other geographically isolated areas who will see significant challenge with these changes. And so we're really working hard to make sure that they are aware of what we've proposed and that we get their feedback as well. I think there's a recognition in the clinician community that the fee-for-service way of reimbursing clinicians, the volume-based payment structure really does have significant perverse incentives, and a change is needed. But there are many different approaches to alternative payment methodologies. And so as we move forward in the rulemaking process and we close the public comment period later this month and move towards releasing the final rule, I think clinicians are very interested in engaging with us and hoping to continue the conversations that have already started.
That's great. I will say Ashby and all the regional chief medical officers have been huge resource all the time, but even especially in MACRA, a huge resource in terms of engaging with stakeholders. So thanks, Ashby. Kate, as the executive leader of MACRA, how are you engaging teams across CMS?
Thank you, Charlie. So I do want to say that I think that we started off with a good foundation for collaboration across the agency. My experience working with CM and CMMI and OC and others, I think we really have collaborated well over the years. What I would say we're doing now is very intentionally changing our culture, which really gets us to collaboration on steroids, if you will. So we've developed this very large integrated project team that involves leadership and staff from across the agency to implement on MACRA. And I will tell you that I think at this point, nobody working on the quality payment program across the agency thinks of it as just, CCSQ is doing MIPS, CMMI is doing APMs, OC is doing communications, OTS is building the portal. We have very, again, intentionally integrated members of each of those parts of the agency and many others on each of the teams so that you can't have a conversation about the policy without having the IT systems folks there and the communications folks there. So they're literally side by side every single day working together. We even have our own space over across the street. I've heard it called Portalville. I call it the War Room. I'm not sure what it's actually called, but that's where the teams go. This integrated team works every single day. And to get back to a point that Karen made that I want people to hear, I can tell you for me personally, I'm working with people across the agency that I've never worked with before. I've gotten to know Janet and George and Dave, people I never worked with before. And I think what I hear my team saying, what I would also say is that working in this fashion, first of all, we're able to identify problems earlier, no question about it, but it's also just a lot more fun. I think we are definitely having a lot more fun with this project, even though it is very fast-paced and very hard. Being able to work in this way has been incredibly rewarding.
That's great. Natasha, as you know, patients and beneficiaries care about access to care, quality care, a positive patient experience and better outcomes. MACRA won't mean anything if we don't meet those metrics. So how do you think, in your opinion, MACRA will impact that doctor, clinician, patient relationship and ultimately better care coordination and outcomes?
Yeah, great question. And I think Kate's comment in terms of collaboration is hitting it on the head. I believe what we will begin to see is greater person and family engagement as a result of this work. As a matter of fact, and you may know this, Dr. Conway, so through some of my work with TCPI, so up under Dennis Wagner and Dr. Fleming and Lieutenant Butler, what we found with those clinicians that have said, yes, we want to be a part of this, is that patient-centered care designs is first and foremost. So what we found, in beginning to engage these teams in terms of looking to improve, our cost structure, looking to improve quality, so on and so forth, is that they said we have to have the patient at the table. And not only do we have to have the patient at the table, so as a part of this collaboration that you're talking about, that the patient really is the focus of that work. And so hearing from real people about real issues so that we can solve those together is really where I believe we will be going moving forward.
That's terrific. And I really do. I don't know, I'm not aware of an all-staff where we had this may be our first all-staff. I know in the last, 5.5 years we haven't had one directly with a patient representative, and so I really want to thank you for the work you do on behalf of patients and for being here today. I think it's really special.
Thank you, Dr. Conway. I appreciate it.
So, Ashby, it's hard to follow that, but you really talked a little bit about the physician-clinician engagement, but maybe tell us a little bit more about how we're engaging stakeholders broadly in this process.
Absolutely, and I think what Natasha just said is really key, that it is beyond simply the paying for services and the reimbursement to clinicians that we're focusing on as part of our outreach. In addition to the centers that Karen mentioned within central office that are really collaborating on this communications and outreach plan, the regional offices have really engaged significantly, and we're developing a region-wide communication plan in concert with our central office colleagues in order to ensure that we really do the most timely outreach and that we can respond to the tremendous amount of speaker requests and presentation and information requests we're getting, not only in the central office but also in the region. Our regional chief medical officers are actually very engaged with our local and our national associations with respect to the different clinical specialties and the different clinician groups who will be affected by these changes. And we're also developing a unique approach with this outreach where we are engaging with a cohort of clinicians external to CMS who will assist us in providing feedback as well as potentially helping us to do more specific outreach with some of our clinician stakeholders. This group of champions, we're calling them clinician champions, really will be a key cohort of folks that we will be able to use for our own feedback as we develop additional resources for the quality payment program, and then as we move forward in reaching out to those clinicians who we really want to make sure have the tools they need to succeed. We're also casting a wide net to hear from different clinicians from different specialties, a group that we're calling the Clinician Voices, who can provide us and really engage with us specific feedback on how these proposed changes will be affecting clinicians in different modes of practice and in different specialties. And finally, actually, as Natasha mentioned, we're working very carefully on technical assistance and outreach to clinicians, again, across the nation and in different regions. The Transforming Clinical Practice Initiative, or TCPI, is one way that clinicians who are working to prepare for participation in alternative payment models or just to prepare for being ready for the MIPS program can actually engage now in technical assistance with some of our organizations across the country. And we also just yesterday announced some opportunities for organizations to work specifically with solo and small practice clinicians to help them prepare for these changes as well. Of course, we're also doing webinars and developing fact sheets. And we've also developed a listserv that people, both internal and external to CMS, can join for weekly updates. Of course, collaborating with our Quinn QIOs has also been a big part of the regional strategy to get this information about the proposed rule out to the community. And of course, we'll continue to do so once the final rule is released as well.
This is great. Well, in the interest of time, I want to thank all our excellent panelists. Please give them a round of applause. Thanks. We're, as you heard, I think a great opportunity for collaboration across the agency and most importantly, really partnering with physicians and clinicians and most importantly, impacting patients and patient outcomes. So thank you all for being here. We are going to move quickly to Q&A if people have Q&A, and then we'll move to Kara. You can, yeah, you're fine. Or you can stay for Q&A if you want. So if people have questions, if you can come to the mic. If people don't have questions, we'll go directly to Kara and John. But we did want to open it up if people had either comments or questions. And this is for Andy, Mandy, or myself, as long as Andy can stay. Any questions or comments? None in the big group. This does often happen with the big groups. We debated planting a question, but we figured that, not necessarily necessary. So with that, thanks again to the panel, and we'll move to Kara and John.
Great. So as Kara and John are getting hooked up, we have as our next segment today, and in follow to the discussion about MACRA QPP implementation generally, we wanted to come back and talk about an initiative that we rolled out in February to focus on rural health providers and hearing more about their needs and making sure that those needs are reflected in the policy and operations that we implement across the agency's programs. I'm really delighted to have Cara James up here with me, Director of the Office of Minority Health, and we're hoping that Deputy Consortium Administrator John Hammerland is dialed in from Townsend, Washington, where he is our man in the field today. Cara, why don't you tell us about what's going on?
Thank you,
Oh,
Karen.
yeah, here, why don't you take this one?
Switch
You
it
got
on. Okay.
Okay.
So thank you. So we're very excited to talk to you today about the CMS Rural Health Council. And as Karen mentioned, this is something that Andy kicked off in February, and he challenged us to really focus on 3 areas. The first is to improve quality and access to high-quality health care in rural America. The second is to address the unique economics of providing health care in rural America. And the third is to really bring a focus of rural health issues into our delivery system and payment reform issues. So since then, as we're looking at breaking down silos, we've pulled together a council that I like to call our rural community, because we are so excited that so many people have been interested in this. But the council consists of members from many of the regional offices, but also 16 of the centers and offices of CMS. So we have really good representation across the board. And we've started our agenda of putting together a portfolio of work, and one of those things is focusing on stakeholder engagement. And so I'm going to turn it over to our roving reporter and our co-chair, John Hammerland, to talk a little bit about what we're doing with regards to the stakeholder engagement. John?
Hope I'm coming through okay.
You are?
Great. Well, greetings, everyone, from Port Townsend, Washington. This is the first stop on a 3-day rural road trip in which we are visiting 8 regional rural facilities, including 3 tribal clinics. We're going to log about 650 miles and about 40 minutes of ferry crossings. And at each stop, we spend about 30 minutes informing the rural providers about timely policies and initiatives like QPP, like new payment rules, CMMI initiatives, recertification issues, and billing and coding issues, opioids, and even Zika. But we devote most of the time to listening, and the listening is really the most important part, as we let providers tell us whatever's on their minds about CMS programs. And we take in all of that environmental scan information, we synthesize it, and then we submit it to all of you back in Baltimore and D.C. to inform future policy making. And this kind of road trip is pretty typical for most of the regional offices. It sort of reflects our outreach mission and our commitment to being the agency's eyes, ears, and spokespersons on the ground. But road trips are just one part of the Rural Health Council's stakeholder engagement strategy. We are in the conceptualizing stage of a really exciting stakeholder initiative. We hope to hold in September in Baltimore a rural listening session and solutions summit centered on ensuring access to care to rural Americans and addressing the unique economics of rural communities and looking at the delivery and payment reform initiatives that work for rural providers. So that's what we're up to, and I'm glad to talk to you all from rural part of Washington State. It's time for my first meeting, so I'm going to hand it back over to Karen and Kara. Thanks.
Thank you, John. In addition to the stakeholder listening sessions and engagement that we're doing, we've also done some internal listening, and we've talked to components across the agency to find out what's already underway and how you guys are incorporating a focus of rural health into your work. And it's been quite informative and is helping us as we have really identified 2 priority areas that we are embarking on work. And the first is what we're calling a rural proofing. So we have a rural proofing work group that's really helping to develop a systematic way in which we can incorporate a rural focus into our policies and payments as we're moving forward. And the second is a group that's focused on developing innovative strategies for how we can improve access to telehealth over the next few years. And so both of those work groups have kicked off, and we're looking forward to developing some work and efforts to improve access, quality, and innovation in rural America. So thank you, Karen.
Thank you very much, Cara. Really appreciate your coming up, and particularly appreciate John joining us from Washington State. We have a couple minutes left. Weren't sure we're going to make it through all of our very active and full agenda today. I'll take just 1 minute to give you an update of where we are with respect to our lean implementation and spread activities. We had a really terrific retreat with the senior career leadership team a couple of weeks ago, at which we had Dr. John Toussaint come from the Theta Care for Life organization to provide our leadership team with an overview of lean implementation, lean management operating system implementation. In addition, Greater Baltimore Medical Center here in the Baltimore area has been very generous in hosting us as they share their lean spread activities. They are very, very heavily engaged in implementation and have a very mature lean management system in place. We have been tremendously fortunate to see them share their lessons and are incorporating that into our planning activities, as we also discover other areas in this, other organizations in this area that have moved forward with implementation of lean. What this means for us, over the next few months, we have started our second cohort of lean implementation. We have a small cadre of expert staff now in the office of the Chief of Operations who are supporting lean spread activities across the agency. And we've also appointed a steering committee that is made up of leadership, managers, staff across the agency. They will be helping us to guide our lean spread activities. So more is coming. It's moving forward, and we're very excited about some of the improvements and changes that we have been able to implement using this methodology and leveraging some of the process improvement activities that are already underway across the agency. I think lean is a perfect leveraging of some of the work that we do as CMS employees in terms of thinking and rethinking how we do our jobs. And that will only help us as we continue to work on implementation of QPP and many of the other initiatives that we have underway within the agency. In the last 2 minutes, I'm going to turn this back over to Mandy to close things out. Want to thank you all for your time this afternoon and look forward to our next session.
Great. Less than 2 minutes. Just wanted to close out by recapping a few of the themes that we've heard today. One is certainly a thank you. Thank you for all the hard work. Thank you for everything that you're contributing to the CMS family. Second, a lot of exciting times. Hard work, challenging certainly, but exciting in that how we're approaching the work differently. Also how we're interacting with the external world differently. Thank you again, Natasha, for having you here and for sharing your perspective. And then also just give you a flavor of some of the things happening around the agency. Again, we are always open to feedback. If there are different things that you want to see or hear at these all-staff meetings, we look, please get in touch directly if there's feedback. follow Andy on Twitter to keep in touch about what he's up to, when he's thinking. He was live tweeting as I was sitting next to him, if you're wondering what he's thinking about. And lastly, I would just say that we just announced the CMS Honor Awards that we will do this September. You will see a great focus of those awards will be on our focus as a family on our beneficiaries, on consumers, on the stakeholder world, and thinking about how best practices in that space. Also this year, Andy is going to personally select the Administrator Award. So much good work that we want to recognize, but just want to make sure that you knew where our focus is for those awards. And then lastly, I'll just leave you with, have a great summer. Enjoy time with your family outside of work, in addition to the great work you do here at CMS. So thank you so much. Oh, tornado warning. Oh, geez.
Please remain indoors, stay away from windows, and move to your closest shelter-in-place location immediately. Please remain
Okay. Okay, exactly. Go out with a bang. All right, thank you guys.